Hey guys, everyone wanted me to do a video on the Aqua Gold again and why I use it. And the reason why I use it is to reduce the pore size of my patients, help refine those fine lines, and help tighten the skin. So here I pop out the Aqua Gold, I take my Volbella, something hydrophilic that's not like super expensive. I don't know how to say it in the right way, but you know what I mean. Like Volbella, I don't really love anywhere else, so I'm using it. I use about 0.1 to 0.3 each little Aqua Gold container. So you can see that's at the top of the Aqua Gold. Still, the needles are still covering it. So I just plop it down on a 4x4 and then pulling up lidocaine, 1%. I pull up about 0.5. I was like, why do you use lidocaine if you use topical? Well, I go really deep with it, and my needle size, it goes 6 millimeters deep in the skin, so it's a lot. So I add a little bit extra lidocaine because it allows me to bring the skin to bleed, because that means you're getting the right depth. And then adding the lidocaine will help to spread a little bit more, and then a little bit of pain control afterwards. It's just a bruise sensation. Then I put in 1 ml of bacterial normal saline. You can do 0.5 as well. And then I like to use a B complex or a B12. The B complex smells like poop. It's pretty gross. And then the B12, I like it a little bit better because I don't know, it just looks red. People love it. They're like, oh my gosh, my face is red. And then I go home and I clean it, and I make sure they clean it with sterile water, distilled water, like bottled water. But you can see the B complex looks bad, and ours is compounded, so it smells terrible. It's not a good smelling one. And then Zeman is what I use. I dilute it 2-to-1. So that means I use 2 mLs of bacterial normal saline to 1 bottle of Zeman. And then I drop, usually depends, like 15. Okay, so my secret is I do 15 units in the actual Aqua Gold. And then I'll drop another like 15 or 20. And I factor this all into the price. And then I inject, and I show you guys this next because I just had someone text me asking about how to inject into the pores. So I put 15 units in the actual Aqua Gold. Then I take another 15 or 20, and then at the end of the procedure, I will add right into the pore. So hopefully that makes sense. You can see I just plop it down there. And then I'll show you how I inject. So this is after, obviously she's done. You can see everything is bleedy. You can see I take my Zeman that's diluted 2-to-1, and I find the pores. Usually the patient will show you. They're like, this pore bothers me, and you can see it. And I inject, so I'm very, very subdermal. So you can see I create a wheel. It's just like a crow's foot, like a very, very superficial. You don't want to go deep. Obviously, if you hit the zygomedicus major or minor or LSAN, they won't be able to smile for a couple weeks. So I'm very superficial, usually because it's 2-to-1. You're not getting a lot of spread. Some people do 4-to-1. I just think 2-to-1 works better. And then I do the T-zone. Mainly, a lot of people get this done too because they have a lot of oiliness. So the T-zone's awesome. T-zone would be forehead, nose, bridge. I do run in the nose, and then you can do cheek area, even the chin. It can help with breakouts a lot. So my patients love it. And I have to say, for me, I have huge pores. I've always had them. I don't know why. So for me, I do this like every 4 to 5 months on myself, and it's a game changer. My makeup doesn't go into those pores. So your patients really love it. They don't necessarily know this exists. So this is something you'll have to talk to them about in consultation. So you might have to say to them like, hey, we can do something for it, but nothing, you're born with your pore size. Your pore size gets bigger as you get older, right? Because think about compensation. Your pore size gets worse with the more sun damage you have, the more makeup you wear, all that stuff, things that help pore size, Botox into the actual pore, salicylic acids, retinols, ablative therapy, chemical peels, but they're all temporary. It's all temporarily closing that little pore. It's a little muscle. So just tell them, like, usually patients come every 4 months. It's addicting. People get really addicted to it. So you can see I'm just doing topically all over the place, very, very small amounts. And then sometimes if I have any leftover, I'll go right into the crows. So hopefully you guys enjoyed this, and feel free to text me any questions.